location. For more than 115 years, Neighborhood House has stood shoulder to shoulder with our community in crises large and small, but nothing has been as impactful as COVID-19. COVID-19 has been especially difficult for our BIPOC, immigrant, and refugee communities, and has deepened the disparities that have already been there. And Neighborhood House is committed to addressing these disparities, and for the last 18 months, we have distributed millions in rental assistance. We have prepared young children and school-age children for school and with after-school programs and summer programs. We've helped people access unemployment benefits, and we have vaccinated over 2,000 people through our pop-up vaccination clinics with our partners Pliable and many other partners, and our vaccination navigation work. We are grateful for the city's leadership and partnership in helping keep our community safe, and we are so excited to welcome our partnership with the city and with Pliable to vaccinate many more hundreds and thousands of people that will be coming to High Point location so that we can all remain safe. At this time, I'd like to welcome our mayor, Mayor Jenny Durkin. Thank you.
Good morning, everyone, and thank you, Janice, for the welcome, and thank you for letting us be here. I want to thank you and Neighborhood House, but also this whole community for the way they've rallied up during the COVID. And I was telling Janice, you know, she's been working in community for a long time. She started this job at Neighborhood House just months before the pandemic hit. And we're thankful that she's here. I want to thank the nurses from Pliable and their whole teams for the work they've done vaccinating so many people and for stepping up yet another way. And I want to thank Councilmember Herbold. There has been zero daylight between any of your city leaders on the fight against COVID-19. At every step of the way, we've been working to figure out not just how do we offset the health impacts, but how do we make sure that those communities who've been disproportionately impacted by COVID, whether it is the health consequences or the economic consequences, that we're very intentional on making sure that we change those disparities. Nothing could be more important than vaccinations. And when the city launched its vaccination efforts, we were really intentional in working with our community-based partners who are closest to the communities who are impacted, because we also knew they would be trusted messengers and be able to get to people to get them vaccinated. We have really made incredible progress in the city of Seattle. It has been the hardest 20 months for our city. I don't know a person, a business, or family that hasn't been impacted. And through it all, we as elected leaders have had to ask people to make really hard choices and do really hard things. We saw in the early days of the pandemic so many businesses closing, so many people losing their jobs. And the city really rallied to see how did we support small businesses with support, how did we support workers and families, and then how did we really focus on the health consequences. It's hard to remember, but when this first started, we had no vaccine and we had no tests. And so we really had to push and innovate and pivot as a city to keep ourselves safe. First with testing. I can't thank our fire department enough, first standing up the testing for first responders, and then for our senior centers, and then a citywide vaccination effort second to none in the country. And both though testing and vaccination paid off. Through this hard time, the city of Seattle has the lowest incidence of disease, hospitalization, and death of any major city in America. An analysis has been done. If every city had done what we've done, thousands of lives would have been saved. But yet here we are in winter, and we know that again, we want everyone to get their flu shot. Really important. We didn't have a flu season last year. We're going to have one this year, so get your flu shot. But we're not done with COVID, and we're really thankful for Neighborhood House and for Pliable and for the leadership from the City Council and across community organizations, businesses stepping up to do the right thing to get people vaccinated. We know it is the best defense against COVID. We can't go back to normal unless we have more people vaccinated. We have seen this disease is relentless. It is a predator, and if you are not vaccinated, it will probably find you. And it's not just you. If you're not vaccinated, you're so much more likely to get COVID. And if you get it, you likely will transmit it to the people closest to you, to coworkers, to families, to people that places you go to. So that's why we've been so intent. And we are one of the most vaccinated cities in America, but we have a ways to go. You know, I want us to hit 100%. I know that's not realistic, but I think Seattle can get close. We've been very pleased with the response from our city workers on the vaccination mandates and the state workers. The vast majority of people stepped up and said, yes, I'll be vaccinated. We had a small percentage who have either medical or religious exemptions, and a very, very small percentage who just didn't want to comply at all. And if you look at that vast majority, people are voting with their arms. They're voting to keep their community safe, their coworkers safe, their families safe. And as we move into this winter, we know the most vulnerable really are our children. And if they're 12 and below, they can't get vaccinated yet. Soon, and we have a plan for that. But we know kids are kids. They're back in schools. When I was my kids were much younger, we called them Petri dishes because they would bring everything home. And we want to keep our kids healthy. We want their teachers to be healthy. We want our communities to be healthy. So this is a really important day for us to set up these vaccination clinics, to be close to community, to make it easy for people. They can register online or they can just walk in. They can get their first vaccination, they can get their second vaccination, or they can get their booster. Pfizer, Moderna, J&J. They're going to have 3 different ways to do it, as you're going to hear, and a place for kids. So really, this being the heart of a community that we know has been underserved but is really rallying at this time is really important, and really important for West Seattle to have a vaccination location. Very mindful that with the bridge out, this is, as some people say, has become an accidental island. And we've got to really take steps for across the board to make sure that we can serve the people of West Seattle and Delridge and South Park. So very excited about that. And now I'm going to turn it over to Councilmember Herbold, who I really thank for being here, and we're in her district, and also thank for her strong and steadfast support of what we need to do to keep our city healthy. Councilmember Herbold.
I'll keep this short and sweet. We all know how important it's been to District 1 folks to have a District 1 testing site and then a District 1 city-run vaccination site. Really appreciate the fact that the mayor, working with the Seattle Fire Department, did so over at Chief Sealth. It's been really indispensable for folks who are on the peninsula with a bridge that's down. And so when the mayor's office reached out to me a few weeks ago and said, hey, we're going to do it again. We're going to open up another city-run vaccination site for the boosters and for vaccines for young folks under 12. Where should we go? And first place I thought of after Chief Sealth, but the first place I thought of inside for this time of year was Neighborhood House, because I had participated in a vaccination clinic as a volunteer for a day a few months prior, and they were working with Pliable at the time, and it was just a very, very well-run day. Everybody was really upbeat. Both folks coming in to get their shots were upbeat. Folks delivering the shots were upbeat. It was like a really positive experience coming out of the darkness that we had all been in. And Neighborhood House is also a draw for the district. It's not just the community directly surrounding the folks who live here in High Point that come to Neighborhood. It's folks from all over the peninsula. And so just thought that this would be a great place to go, and I'm just really thrilled that District 1 will again have access to a city-run vaccination site. Boosters are now available for many, and soon vaccines for those under 12 will arrive, and that's really great that relief for young people, their teachers, and their families is in sight. So this is a perfect time for us to open up this site, whether or not you're getting a booster, whether or not you have a young person in your life, or whether or not you still haven't gotten your first shot. This will be the place to come here in District 1. It's a city-run site. We're really lucky to have the partnership of Neighborhood House along with Pliable, who will really be running the show. And I'm really grateful for the leadership of Neighborhood House organization I've been a strong supporter of for many, many years, former board member and the leadership of the mayor's office in making this all happen. So thanks.
Good morning. Thank you so much, Mayor and Councilwoman Janice, for having us here today. I'm Nicole Warner. I'm a nurse practitioner and co-founder of Pliable. We are a West Seattle women-led business dedicated to mindfully driven healthcare. Powered by the shared purpose of community wellness and equity, Pliable is honored to partner with the City of Seattle and Neighborhood House for this vaccination hub. We continue to stand in awe of our local and state public health teams and their resilient workforces. Over the past 10 months, our mobile team has touched every corner of vaccine distribution and outreach in King County, from mass clinics to events out of our Subaru. It feels very appropriate that we return home to Neighborhood House today for this project. This was the first site of our first large-scale clinic back in early March. At this standing site, we will offer approved COVID-19 vaccines for all eligible persons, including first, second, third, and booster doses. As a mother of 2 young ones, I know I speak for many of us who are beyond ready to protect our children, and we hope that's just around the corner. We look forward to this next phase of the rollout and are privileged to serve our neighbors and their families. While these have been challenging times, it's been overwhelmingly inspiring to be involved in these vaccination efforts and to have a front row seat to the resilience, kindness, and strong community that surrounds us all. Thank you very much for having us.
Thank you so much. And I think that just reflects really what we've seen through this darkness. There has been so much for us to be inspired by. I tell you, every time I go to a vaccination clinic, I would be inspired by the people coming in there, by the volunteers, by the healthcare workers. I mean, Lumen Field, I sometimes kidded, was the happiest place on earth. It wasn't Disneyland. But going to the neighborhood community vaccination clinics and testing clinics was also inspiring because you could see that sense of community, that sense of wanting to protect and coming together to do something positive, taking control over a virus that has controlled so much of what we do. So again, I just want to thank you for everything you've done. And really remarkable that we wouldn't be where we are, though, but for the efforts of the people of Seattle. They've stepped up every step of the way to do what's right. And as a result, as hard as this is, we really are so much better off than so many places. And that really speaks to the resilience and the community strength of Seattle. So any questions?
Yeah, I've got a couple of questions for Nicole.
Good.
And we're just
Nicole, come
looking,
to the microphone.
This is going to be 2 days a week for starters. Are you ready to scale up beyond that when children, for example, are approved?
Yes, so we have a very, very good plan. We're pretty flexible in what our abilities are. We've sort of oversupplied our stock in anticipation of all of these things being approved at the same time. So we are grateful that we have a very big space here. And so we have a strategy to make sure that all 3 adult vaccine types have their own space within Neighborhood House, and then we'll have a separate area for pediatrics to receive their doses. I'm sure some of you have seen the way that we have run our clinics. They're very fun. We have balloon arches. I'm not going to make any promises that they'll return, but we make it fun. There'll be movies, there'll be music, and it will be a real welcoming environment for everyone, but especially for children. We've been very cognizant of the way that we are planning our staffing for these events. So we'll have pediatric-specific medical providers with higher level degrees. Yeah. Yeah, it's pretty rad. I'm not gonna lie. My kids were 1 and 3 at the beginning of the pandemic, and I was working in a hospital system. So we were in the trenches. Maybe I had some children in behind me during medical consults on Zoom. So we've seen it all. Tara and I actually lost our hospital positions. So like many people, we were laid off during the pandemic. And we just quickly pivoted and were put in contact with some really, really wonderful women at Public Health. And they said, hey, you're starting your own practice, why don't you push pause and jump in and help? And we couldn't have been more proud to do it. So just to see this full thing to fruition to where we're at, I am very hesitant, like the mayor, to say that, you know, normal is around the corner, but I do feel like the hope is getting a lot stronger, and that a big part of that is getting the kiddos vaccinated. Yeah.
What about the rest of the city? We know we have a network moving field over at Rainier Beach, West Seattle. What's the plan going forward? Or is this going to be it for now?
No, we'll be opening in a Rainier Beach as well, and we're coordinating also with pharmacies, University of Washington, healthcare providers and the like. There'll be a very more robust system. Unlike early in the pandemic, having enough vaccines is not an issue now. Many of you will remember I went begging everywhere I could to get an allocation for the city of Seattle from the White House to the governor. But now we've got plenty of vaccine, and we have a much more robust system to distribute it. So we'll be looking. I think one really important thing that we saw at the beginning of the pandemic, again, we have to just emphasize all of those systemic disparities that occurred because of our embedded racism and underserved communities were exacerbated during the pandemic. And we wanted to make sure in our vaccination strategies that we didn't also add to that. So we were really intentional about getting to communities that might have hesitancy or might have language barriers. And about 50% or more of the vaccines the city of Seattle did were to BIPOC individuals in a city where that it doesn't reflect the proportion. So we're going to work really hard to make sure everybody can get vaccinated. And let me just add one thing to that, sorry. On the kiddo front, we're also working with Seattle Public Schools. We have a great partnership with them. For the older kids, we were able to go in and have a school-based program to get kids vaccinated. We're already talking to them about how we do it for the younger kids as well. Remember, through our Seattle School Levy, we support nurses and school-based health care in many of the schools. So we're going to be coordinating with a lot of organizations so that we can get kids vaccinated as soon as that's available.
Two questions here, one of which is you said an important thing was people can come here and walk in. So you don't have to make an appointment. If you go to a pharmacy, typically you have to make an appointment, which could give some people second thoughts. And whoever wants to take this can take this question. What are you doing for the rest of the city to be, I mean, Rainier Beach will clearly be able to walk up. Is that the only other sort of walk-up site that we're doing?
Right now they will be, but we're watching the numbers pretty carefully to see where are we lacking, and not just in the first and second doses, but the third dose, working with public health and the Department of Health. We think right now that the strategy of the healthcare-based vaccination is working, but the real gaps is in those communities that may not have that connectivity to healthcare, may maybe have language barriers, there may be physical problems if you're here in West Seattle. So our focus is on those first, but we're gonna wait and see. Every time we've had to anticipate, what's got us through COVID is not just what is the challenge we're facing today, but what's it gonna be in a month and 60 days and 90 days, and how do we get to a place where everyone's safe?
Do we know, because of the school involvement, do we know what the 12, that youth bracket, that 12 and up bracket, do we know what of those people, of those kids who had shots, what percentage of those came via getting into school? This wasn't here versus getting into pediatrician versus.
Let me get back. I think we do have that data or close to it through public health. Let us get back to you on that because we know that schools our school-based program was a really important things, but I don't have the numbers at the top of my head. But we can get that to you.
That age group from 5 to 11, which could soon be eligible for the vaccine, how many children are we talking about that we might be able to handle that population?
Yeah.
Yeah. So I can kind of speak to that. So I think the best way to think about this is we have the space, right? So back in March when we were doing 800-person clinics at this site, we were doing those in 4 hours, right? So we have scaled up from that staffing for these events in anticipation of having several different doses, several different strengths of doses now, and then also with pediatrics. Our plan is to have 800 appointments per day at these sites, and that is going to be, on Fridays from 11 to 7 and on Saturdays from 8:30 to 4:30. We absolutely have the ability to scale up if we need to. I don't know if that answers your question, but and to speak to your question before, sir, we've used Neighborhood House, not partnering with the city since March, right? So our team has been holding clinics here. And so for instance, when the 12 to 15-year-old age group got approved, we were here that weekend, Friday, Saturday, Sunday, and we saw so many children. So many children. I would say that probably 75% of whom we vaccinated that weekend were local children. Correct. Yeah, that's correct.
I mean, is this basically surge capacity?
What do you mean by that?
Meaning that because we have the kids coming on board here, maybe as early as next week,
Mm-hmm.
we're already seeing a surge in older folks getting the third dose.
Yeah.
Is that believed to be that the pharmacies and the other, the doctor's offices won't be able to handle that?
It's not that they won't be able to handle it, but I think that they have a task of handling a lot of other very important things, right? So I think we're just trying to fill in those gaps and relieve some of the pressure on the healthcare system. We've been on the other side of this, right? And so we know that in the ER, if someone were to come in and they have COVID symptoms, well, there's also accidents, there's also traumas, there's also a lot of other people who need to receive exceptional care, right? Here, we'll have the ability to scale up, but also, just for instance, I brought my kids to get their flu shots at the pediatrician here in West Seattle and then at Walgreens on the corner here. That was all within the last week. Both of the providers who cared for us could not be more excited that we were planning this site because they're just stretched to the max. So I think this will just alleviate some of the pressures on them, and certainly if it's most appropriate for you to bring your child to get their vaccine at their pediatrician, great, do it, right? But you'll have this as an option. And then the reason why we picked the hours that we picked is to be convenient for families, right? So we want to accommodate folks who work, folks who have to leave West Seattle Island and return back, right? So these clinics are going to be run at very family convenient times, and the hope for that is that we can really make a dent in vaccinating the kiddos as fast as we can.
So if I'm a parent and I'm looking and I want to come to this site, but I don't have an appointment or I have multiple kids, what would you say to that parent?
Come on down. Come on down, we're ready. So, I mean, if you want to secure, you have soccer game here and you have something else here and you need to make sure that you get a spot in the middle of the day, make an appointment. The appointments will be available, right? If you don't and you're just driving by or walking by or playing in the playground in the back, come on down. And that's where a lot of our folks have just kind of happened upon us. So the goal at this point in the vaccination efforts is to make it as convenient as possible in a place where people are comfortable. And that's really what Neighborhood House offers.
Any further updates on the bridge reopening since you
Pass.
Oh, come on.
Construction starts in November and they're on time.
Yep, we're on time, on budget. Construction starts in November. I'm sad to say I won't be the mayor that cuts the ribbon and walks across it next year, but it's going to happen. I want to thank again, this is just an amazing effort, and I want to emphasize that convenience, but also a place people are familiar with or comfortable with, especially for kids. Two of the favorite events I've done as mayor is the back-to-school backpack giveaway here at the school with the kids and the joy on the faces, but also seeing how comfortable those kids are, because it's home and neighborhood. And so Neighborhood House really is neighborhood. And it serves all of West Seattle, as Councilmember Herbold said. So having that place that's convenient, that's familiar, that's comfortable, and darn effective. So thank you very much. Thank you, everybody.